Welcome, everyone. Thank you for waiting. Delighted to be here with our partners, particularly the Attorney General, on this very, very important bill that will be heard in this committee room right after session. It's scheduled for 1 o'clock right now in the Business and Professions Committee. And again, I want to thank Public Safety and all our partners on now this is my third attempt to get funding for the Cures program. And I want to particularly thank Bob Pack, who brought me this issue, and he will be the last speaker today from his own tragic experience. But first of all, let me just speak for a second about the problem. Prescription drug abuse, unfortunately, to many Americans, aren't aware of what an amazing challenge for America this is. Americans represent 6% of the world population, but we use over 80% of the opiates. 6 Californians on average die every day from prescription drug abuse. Prescription drug abuse, according to the Center for Disease Control, that's classified as an epidemic where deaths and addictions have increased every year since they did that, says that we actually costs us more and more people die and addicted from prescription drug abuse than illicit drug abuse. More people die from prescription drug abuse than cocaine and heroin combined. The Workers' Compensation group from California did a study that said just on workers' compensation it costs California $50 million every year because of prescription drug abuse. So this bill, again, as I mentioned before, is my third attempt to get funding for Cures, our prescription monitoring program. What we did was we've had dozens of meetings with stakeholders trying to work out some kind of agreement how we would fund Cures. My other 2 attempts, we've tried different ways to do it, and I haven't been able to get out of the first policy committee once, and the second bill died in the Assembly, so it's a challenge. This bill, after dozens of meetings, to be fair, we tried to spread the pain, so to speak. So we increased the licensing fee for practitioners, people who write prescriptions, doctors, veterinarians, nurses, pharmacists. We increased it by 1.16. So very little amount. The largest increase, based on the base, is for doctors, which is about $9 a year. $9 a year for doctors. The doctors, the CMA, just recently agreed to increase their licensing fees by $40 a year to deal with drug abuse for their own members. So we think this is a small amount. The second 2 parts of our funding sources come from taxes on pharmaceutical companies and taxes on health insurance providers, including workers' compensation providers. All of that will generate a little bit under $9 million a year to both upgrade the system, to maintain the system, and then to give the tools for the Attorney General and the Department of Justice to do the proper investigation. So it's important to remember that California led the country on prescription drug abuse. We were the first state to have a prescription monitoring system. We were the first state to go ahead and make it advanced, make it technical. Right now, though, of the over 200,000 prescribers, we've only got about 2,000 actually using the system. This bill would require everybody, once the Attorney General and Department of Justice upgrades it and knows that it's capable of taking all the prescribers, will mandate them all to become part of the system. So we were the first. If we fail to get this bill out as an urgency and off the floor, as of July 1st, we will join Missouri as the only 2 states that doesn't have any system at all. So we'll go from first to worst. We want to make sure that doesn't happen for the Bob Packs and, unfortunately, the hundreds of people in California who have had to go through the kind of grief and suffering that Bob has gone through. So with that, it's my pleasure to introduce a very stalwart partner in this effort. She's been with us every step of the way, and her staff, Ken Pogue, is in the room today to answer any questions, technical questions. They've been absolutely relentless, and I appreciate her partnership. The Attorney General of California.
Thank you, Senator, for your longstanding leadership, and in particular on this issue. I've had the great fortune of being able to work on this with you for the last couple of years, and I thank you. We are also joined by some leaders in law enforcement who are here to emphasize that Cures is really the point of intersection between public safety and public health. And so joining us is also Chief Lerner from Elk Grove and Chief Lawrence from Rockland. And we are here as leaders in law enforcement because we recognize that the Cures program, it saves lives. The public health model tells us that if we're going to deal with any epidemic, be it a crime epidemic or a health epidemic, it is smartest to deal with it from the perspective of prevention first. And then if it's a little too late, if the sniffles take on, we'll get into early intervention. But if we are at the point of addressing a serious public health or public safety issue in the emergency room, it's far too late and it's much too costly. So what we are doing, and in particular what Senator DeSaulnier is doing with SB 809, is essentially giving the resources that are necessary to keep this program going. And what does it do? It's pretty simple. It's a database. Physicians, pharmacists, and law enforcement can all access it in a way that we can figure out if, for example, a patient is getting access to medication that actually is contradictory to other prescription medication that they may be getting from another physician. So we can catch that at the front end to make sure that that patient is not taking medication that will in some way harm them because it's in conflict with other medication. The other thing it will allow physicians to do is to figure out if the patient is basically a drug-seeking patient. If they are going to various physicians in different places to get the same medication because there's an addiction issue. What we do with Cures is that we maintain the database at the California Department of Justice. And we work with physicians, we work with pharmacists to make sure that that information is current and up to date and that the database is robust. Seems like a simple point, but it is resource intensive. It requires individuals in my office to be able to receive the information, to input it, and to track it, and to share it with the physicians. It also requires that we have agents, sworn agents, that have the ability, where there is a need for interdiction, where there is a need for a law enforcement response, to go out and to make sure that we deal with it in a way that there will be consequence and accountability. You all may know last year, my office, and in particular, the California Department of Justice's Division of Law Enforcement, took a $71 million hit to our budget. It practically decimated the Division of Law Enforcement for the California Department of Justice. We had to lay off about 100 special agents. And in that process, the Cures program was on the verge of being shut down. We put it on life support to keep its essential function going. But if we are going to address, as the Senator has outlined, one of the most serious public health and public safety issues that we as a state are facing, we have to make the Cures program robust. It has to be staffed up in a way that it can actually fulfill its intended purpose. We also know that the reality of doing this work is going to be addressing the mundane. So part of what the revenue from this legislation will do is it will allow us to update the database in a way that is consistent with current technology and the benefits of current technology. It will allow us to rehabilitate, frankly, the system and the computer system, the technology that is associated with this. It will allow us to do the work of maintaining it every year because, as we know with any data system, it does need to be maintained and it needs to be upgraded as technology upgrades. So those are some of the important, perhaps seemingly mundane, but critical issues that are at play when we talk about the need for this bill. I'll close by saying that this is simply about supporting what all of the public should expect will be a smart and efficient government. That's what this is about. And it is also about breaking down silos between, on this issue of abuse of prescription medication, the silos that can exist and often do exist between physicians, pharmacists, and law enforcement. This will break those silos down in a way that we will save lives. And as Senator DeSaulnier described, we know that we now have more Americans that are dying from prescription drug abuse than die from auto accidents. It is very serious, and this is a solution. Thank you. And I'm going to now introduce Chief Drummond, who is the West Sacramento Police Department Chief. He has been a long-standing leader on smart on crime approaches to achieving public safety. He is known and has a reputation statewide for his focus on community engagement and doing that in a way that can partner with law enforcement to achieve our goal of public safety. So with that, Chief Drummond, please.
Thank you, Attorney General. The California Police Chiefs are very much in support of this effort. We appreciate the leadership of the Senator and the Attorney General in this effort. because this is a multifaceted tool that can be used. It's used for intervention, prevention, education, which the Attorney General referred to up front, and ultimately, and sometimes, enforcement. And so prescription drugs are the fastest growing drug problem in the United States. More deaths each year occur from prescription drugs than from traffic accidents. And 1/3 of first-time drug users who are 12 and older, they came into the drug culture. The gateway was prescription drugs. And so this is why this is a vital piece of legislation, and the police chiefs are strongly in support of that. Thank you very much.
Again, I want to thank both the Chief and the Attorney General and all the public safety folks who have been our partners. The Attorney General mentioned silos. A lot of the critics of our bill will say, well, this is a fairly small amount of money in your larger budget. Why don't you just use general funds, or economy's doing better, your budget's doing better. In terms of silos, I've been on the budget subcommittee since I've been in the Senate, both for public safety, where we were cutting the Department of Corrections, and as the Attorney General said, cutting prosecution and cutting the courts. But the last 2 years, I've been chair of the Health and Human Services budget, where we cut $4.2 billion to the social safety net. And all of those cuts have their impacts on Californians, negative impacts. So it seems a little bit audacious for particularly pharmaceutical companies to come and say we should cut those programs more for an industry that sells $1 billion worth of pharmaceutical goods in the state of California every year and whose after-tax profits are very robust. So in terms of all those connections, for me, my original connection, as I said, into this unfortunately tragic epidemic is Robert Pack, a constituent from Danville, California, who on a beautiful Sunday afternoon decided to take his children and his wife for a walk to the local ice cream shop. And on that walk, unfortunately, someone who was on Vicodin and vodka lost control of her car and killed two of his children. So Bob Pack has been absolutely a passionate and committed person to make sure that injustice and things like this do not happen, if at all humanly possible to avoid. My good friend, a great crusader in this effort, Bob Pack.
Good morning. Thank you, Senator. Well, as the Senator discussed or stated that 9 years ago, I lost my 2 children, my 10-year-old son, Troy, and my 7-year-old daughter, Alana, to a doctor shopper, a woman who was addicted to prescription narcotics and in fact had received thousands of prescription narcotic pills from her HMO, Kaiser Permanente. And 2 weeks before the accident where she drove off the road running over my children and my wife, she had received 315 Vicodin, 180 Flexerol muscle relaxants, and took them all prior to that accident. And that started me down a quest and a path that has brought me here today. And that path has been providing the needed data to doctors and pharmacists before they prescribe those medications or before they deliver them to the patient, to know whether that patient is real and to know whether that patient's a doctor shopper, and to know whether they should even prescribe at all to that person. And that could directly prevent tragedies like mine. I'm here because, not only on behalf of my children, but I'm here on behalf of all the thousands of families that have been victimized by overprescribing and addictive drugs in California. And hopefully this bill, 809, will set the tone and give that needed data to doctors and pharmacists so we can prevent the thousands of more deaths that are going to happen if we don't pass this bill. I have worked for 7 years on the Cures program, and 4 years ago I worked with then Attorney General Jerry Brown on implementing the real-time version or the instant access to the Cures database, so it could give that live, rich gold mine of data to doctors and pharmacists. They knew who they were prescribing to. And that program was launched 4 years ago. I helped architect the software for that program, and I helped bring about some legislation and a path that we would try to fund this properly to be the leader in the nation of curbing prescription narcotic abuse. Well, this is the time. This bill is the solution, and we need to have it passed. Thank you.